Oh, so thank you. I can see you've made your way to the treatment plan that I've guided you to. So this is just for reference if you were confused about which plan you're on and if you're on the right plan. And it's also reference so that you know how much your plan's going to be and where you will be at that point. So if you do have any questions at all following this, please do get in touch with me, email me, telephone, ask for Robyn, and I'll get back to you and help you as much as possible. Each plan is tailored to each patient. So one shoe doesn't fit all, and that's the same with the periodontal treatment plans. Things have to work for the patient, and the reason why the appointments are set out like this is to get the most out of your treatment. The appointments that have been researched and we figured out what is going to work using evidence-based resources, make sure that we know we're doing the best for you to get the best out of your treatment. And as you know, my favorite saying, I always talk about it, is that your treatment will not be successful if we don't work as a team. So if you're not doing the stuff at home that you need to do, so using that electric toothbrush exactly how we showed you twice a day, using those interdental brushes, the right sizes, the perfect sizes in between those areas, then things aren't going to be successful. But if you are doing all that stuff and you're really putting that effort in at home, when you come and see me, we can keep checking, monitoring things and check. We can compare to last time and can compare to today's appointment, for example, and ensure that you are making that progression and you are achieving or aiming to be at the stabilization phase that we need you to be. Again, as you know, once you're at that stabilization phase, you're reducing that risk of progression of gum disease and you're reducing that risk then of wobbly teeth and tooth loss. So the aim of the treatment in terms of what I can do for you in the clinic and what you can do at home is to stabilize that gum disease and ensure that we don't get further progression, so we don't get that tooth loss and tooth mobility. So I'm sure I've already spoke to you about your treatment plan so far and discussed your radiographs, which are x-rays, and discussed your charts. If not, then that is coming your way shortly, so do not worry. But like I say, this is an overview of our treatment plans. You can see there's two logos there because we have a sister practice. So Heronsgate Dental Centre and Clock Tower Dental. So this one's called the Periodontal Health Pathway. And if you've been put on this Periodontal Health Pathway, this is going to be £180, but this does include the 3-month review. So the reason why we include the 3-month review is because it's all part of your treatment. If you break your arm and you go to get an x-ray on your arm, the doctor who you are seeing will want to x-ray your arm after that, after you get your cast off, because they want to see if the bone is healed and you've responded well to the treatment. And this is exactly the same with periodontal health, so gum disease. We want to make sure that you've responded to the treatment well, you are in that stabilized category, and if you aren't in that stabilized category, then we can ensure that we put you on the right pathway to make sure that you do become stabilized, and we help you to identify what's going right, what's going wrong, and how we can improve. So these are going to be the gum scores. So you'll hear us shout out these crazy numbers when we do an initial assessment, and this is called a basic periodontal examination. And what we do is the numbers range from 0 to 4, 0 being the better number and 4 being the more advanced gum disease. We use that screening as an identification to what pathway you're going to be on. You know, the higher the number, you are more likely going to need some more extensive treatment with more appointments. If we look at this periodontal health pathway, the first appointment here is your periodontal health assessment and treatment. Now, assessment is crucial. Assessment is so important because if we don't get a baseline and if we don't know where you need to improve or where you have some bleeding when you're brushing or where you're missing those areas that you're struggling with, that is an area that gum disease can progress. So we need to do that assessment to ensure that we can eliminate that risk with all the advice that we give you. It's crucial because when you come into this next one in 3 months' time, we use this and compare the two outcomes and we can tell clinically if you have improved. Sometimes things look great by the eye, but clinically, that tells a much bigger story. So on the first appointment, you then have your treatment. So as you can see, this appointment is 45 minutes and it's £90. Then in however long your recall suits you for, it may be 3, 4, 6 or 12 months, you'll have that other 45-minute appointment, which is going to also be £90. The next stage up in severity is the periodontal risk pathway. And again, when we think of periodontal, we're thinking of gum disease. So this is the plan that is saying that you're at risk of developing some gum disease now. So we've got some different numbers here. So the ones mean that you've got some inflammation and bleeding of the gums, and the 2 mean, again, you've got some inflammation and bleeding of the gums possibly, but you've also now got some hard deposits where these 2s are. That's the kind of stuff that you need cleaning off, because that's the stuff that's going to get in the way of you cleaning effectively. Now, again, this includes the 3-month review. This is going to be £240. So the difference with this one is, your first appointment, you'll have a periodontal risk virtual appointment. The wonderful thing about a virtual appointment is that I can share everything that you need to know in a space that you're comfortable in, and a space that there's no distractions, and we can get every question done, we can get every bit of information out there, and we can fill things in as we go. Then you know where you're going on your treatment plan, I know how you feel about your treatment plan, and you've then been provided with all of the knowledge necessary to get that periodontal risk reduced. I always say knowledge is power, so this is essential. This appointment will also be talking about what you're doing at home, what you need to do at home, and how you can achieve that. The reason why this is going to be more effective before coming in for a risk assessment and treatment is because very often with this kind of gum score, you have inflammation and you have bleeding. To get the most out of your money, you want a good clinical outcome. And to have a good clinical outcome, the best thing to do is reduce inflammation and reduce bleeding first, and your clinical treatment will be more effective. Additionally, it will also be more comfortable because we're not poking and prodding inflamed areas. So if we can get you to really improve that inflammation prior to this appointment, then this means that there's a better outcome generally all round. So again, when you get to this appointment, you'll have your risk assessment. We'll do all of the assessments that we need to, all of the investigations that we need to. We can do 3D scans if that's what's also required. The things that are going to ensure, again, you're getting your money's worth and you're going to get that successful outcome that we both want. I take pride in my work and I take pride that I have successful treatment. And this is why, because I monitor and ensure that treatment is successful. It would be very easy to clean your teeth and say, see you later. But we don't want to do that. We want to make sure that you are improving, and at that point we can reduce your recall. Advancing on the severity scale, this is now periodontal disease. Now the 3, so we've gone up. So the 3s mean there could be bleeding, there could be inflammation, there could be deposits, hard plaque present there. But now there's what we call a pocket, and I've probably discussed a pocket or pocketing with you. But the pocket is a gap between tooth and gum, which allows bacteria to get underneath there. And if that progresses, that's when it starts to affect the bone, because the bacteria essentially eats away at that bone. So if you do have these code 3s, it's essential that we get the information across to you of what you need to do, how you need to do it, when you need to do it. We need to make sure that we prevent things from progression, and we need to make sure that we stabilize things. So you can see that there's a few more appointments in this plan. This plan is £300, again includes the 3-month review, and you'll have the virtual appointment 2 weeks later. The reason why it has to be 2 weeks, or why I suggest 2 weeks, is because it takes about 2 weeks for you to really feel and notice the difference in your oral hygiene routine. So in 2 weeks' time, you're going to notice that bleeding has really started to improve if you keep going and if you keep using the technique that we showed you. And that inflammation is really going to improve too. So by the time we get to this step, then things are going to be much better, much more improved. You're going to get a better outcome. Now, the treatment here is essentially just so you can get your oral hygiene aids in effectively. So we need to do that, because if the hard plaque is blocking up the gaps between your teeth, you're not going to be able to get what we call interdental brushes in there. So we need to clear that space. You can then get interdental brushes in there, address that inflammation too, and then we can progress to the next stage where we can start cleaning those pockets if we need to. And then 3 months later, you have your review again. Now we look at our highest treatment plan, and this is advanced periodontal disease pathway. There's going to be 4s involved in these scores, or a 4 in one area. Now, the 4 means that you've got that established pocket, you've got that established gum disease, so you've got that gap between tooth and gum, and the very, very likely is going to be bone loss present there. This plan is £390, again includes a 3-month review because that's all part of the treatment and ensuring you've responded. And again, you've got your virtual appointment where we can assess things. I'll include your radiographs in there, I'll include any investigations that we've got and thoroughly explain everything to you. 2 weeks later, we have your assessment treatment, and the treatment again is to aid your oral hygiene. So to remove the hard plaque from those areas where you can't fit your oral hygiene aids in, then we can get that inflammation to improve too. Then we do the treatment. Now, as you can see, this treatment is 60 minutes, which is a lot longer than the previous plans. The reason why it has to be 60 minutes, or why it's suggested to be 60 minutes, is because we need to take time cleaning those pockets out and cleaning those roots of those teeth to get rid of that bacteria that is damaging the bone. And this takes time, and it's very technique sensitive. To get a good outcome, we need that time to ensure that we can do this effectively. 2 weeks later, we'd like to review things because we're talking about advanced periodontal disease now. So if in 2 weeks later your plaque levels and bleeding levels are still high, I know that you're not going to respond well to the treatment, or you're not going to respond as well, I should say. And so at this point, I want to make sure that you are on track, making sure we've got everything in a nice position to start the healing process and leave you alone for 3 months' time. And that's it. So I hope that helps. There may have been quite a bit of terminology in there that may be new to you if you haven't spoke to me before, but rest assured, I always discuss this stuff with you at your first appointment or on your Zoom consultation. So I do look forward to meeting you if I haven't met you already. And if I have met you already, I shall see you soon to start your periodontal journey with us.